Discuss some of our questions related to our previous topic. Okay, a young man was reported in IOPD with a painless swelling. So the main thing is it is painless swelling. So there is no pain. Okay, and on his right upper eyelid. The second thing is upper eyelid. For the last 3 months, the size of the swelling has no increase, and he has noticed blurring of vision in the eye. So what is your diagnosis? So the main thing is it is painless. So all of the diseases we have discussed in our previous lecture, only the disease that was painless was lesion, and I have discussed earlier that it mostly in most of the cases it is not a hard and fast rule, but in most of the cases it affects the upper eyelid because there are more meibomian glands present in upper eyelid, so it is simply a lesion. Okay, now other question. A 20-year-old university student is told by her friend that she has right upper eyelid swelling. So upper eyelid is infected, small swelling. The swelling is located in the outer part of the lid. The main thing is it is present in the outer part of the lid away from the lid margin. The meibomian glands, as we have discussed, in case of their inflammation, the inflammation is little bit away from the lid margin. But in case of sty, because the gland of Z's are present near the lid margin, so the inflammation occur near the lid margin, not away. But in case of meibomian, it is away. Okay, the first thing, it is upper eyelid, but it is not a hard and fast rule. The other thing, main thing is it is away from the lid margin, so it is most probably the lesion. Now the other things are it is felt better than seen, and it is non-tender and firm. The main thing is it is non-tender and firm, so there is no pain, so it is the lesion. What is the diagnosis? It is lesion. Now the third one, a young girl is presented with progressive painful upper eyelid swelling. Okay, upper eyelid swelling with a pus. So there is presence of pus which points yellow spot on the outer eyelid margins. So there are presence of, okay, the first and important thing is it is painful, it is progressive, and it is painful. Main thing, it is painful, so it can't be lesion. So the other thing is it is producing pus. The other main thing is it is at the outer lid margin. So as we have discussed that the presence of gland of Z's and glands of Mal is near the upper outer lid margin, so it is sty. Okay, now the topic is blepharitis. So in simple word, it is the inflammation of eyelid. Okay, so there are two types of blepharitis. One is anterior blepharitis, one is posterior blepharitis. So what is the difference between anterior and posterior? So in the case of the anterior blepharitis, the anterior margin and our anterior lid is affected. In case of the posterior blepharitis, the posterior lid, a posterior margin is affected. As we have discussed in the anatomy, in the anterior there is a presence of glands like gland of Z's and Mal, and in case of posterior the presence of tarsal plate or meibomian glands. So these are divided on this basis. Okay, so in case of anterior, it has subtype like ulcerative and seborrheic, are also known as squamous. Okay, and in posterior, as I have discussed, in posterior are the presence of meibomian gland and also the tarsal plates. So most probably the infection occur or the problem is with the meibomian glands. Okay, first we will discuss the interior blepharitis. So its first type is ulcerative. So ulcerative, it is a chronic inflammation of lid follicles, gland of Z's and mole, as I have said already, because it is anterior, so these glands are present anteriorly, so these glands are infected, so it causes our staphylococcus bacteria. So its symptoms are different as compared to the diseases that we have discussed earlier, like lesion, sty, arteriolar internum, like that. So its symptoms include irritation, itching, and gluing of eyelashes, and there is also presence of light sensitivity. So there are two eye like irritation and also itching, and there is gluing of eyelashes. Okay, so it is red swollen eyelids, as the blepharitis itself is the inflammation of eyelid. Okay, then there is presence of yellow crust, as you can see in this pic, these are the yellow crust. Okay, if you try to remove this, these are like dandruff, and if like dandruff, and it, if you remove this, there is bleeding. Okay, if you try to remove these, bleeding occur. So it is ulcerative blepharitis. In simple word, ulcerative blepharitis, the infection occur in the gland of Z's and mole because they're present anteriorly. Then its symptoms most are irritation, itching, then there's gluing of eyelashes. Okay, if you try to remove this yellow color scale, the bleeding occur. Okay, its complication include corneal issue, the cornea may be affected, or other like conjunctivitis or other diseases. Okay, then we will move towards the second type of anterior. First one was ulcerative and the other is squamous blepharitis. So it is also anterior, so the disorder occur in this case also with the gland of Z's and mole. Okay, the cause is unknown. Okay, but in the case of seborrheic dermatitis, it also plays an important role in case of squamous blepharitis. Okay, then there is treatment. First is lid hygiene, which is very important. So warm compression, a lid scrap by diluted baby shampoo. Antibiotic ointment can be used, which in this case is sodium fusidic acid or erythromycin. Topical steroids can be used, and in this case artificial tears are used. Okay, so these are squamous. It is also squamous, as we discussed, gland of Zeals and mole. So its symptoms are little bit different, like whitish material on eyelid. In the case of the ulcerative, this presence of material on the eyelid also, but there is mild discomfort or irritation. In case of ulcerative, the irritation and discomfort was very extreme, but in case of squamous, it is not very extreme, it is mild. Okay, there is eyelashes loss and there is occasional watering. So its signs are lid margins become shiny, waxy, erythema, and there is also scales soft, non-ulcerative and remove. In case of ulcerative, when you try to remove these scales, bleeding occur, but in case of squamous, the bleeding does not occur if you try to remove these scales. Okay, eyelashes are also greasy. Its treatment, as we have discussed earlier, eyelid hygiene, topical treatment, or underlying condition if it occur due to like seborrheic dermatitis, so we have to treat this. Okay, in simple words, we will summarize on the anterior blepharitis. So it has two types. One is squamous, one is ulcerative. In case of ulcerative, the staphylococcus is the main bacteria. In case of squamous, the cause may be unknown. So in both of the cases, the anterior lid margin is affected. Okay, there is presence of yellowish scale in both of the cases, but if you try to remove the scale, if the bleeding occur, it is ulcerative type, but if the bleeding does not occur, it is squamous type. Irritation or gluing of eyes, and if the irritation is very extreme, then it is ulcerative, but if the irritation is little bit mild, then it is squamous. So this is summarized form of. Then treatment is like same like hygiene, topical treatment, or if it occur due to any underlying cause, then we have to treat that cause. Okay, this is also summarized form of squamous and ulcerative. So scales, in the case of squamous, these are white, fine and dry. In case of ulcerative, they are yellow, sticky. So ulceration occur if you try to remove these scales. Ulceration does not occur in case of squamous, but it occur in case of ulcerative. That's why we called it ulcerative. Bleeding absent, bleeding is present if you try to remove these. Okay, loss of eyelashes, few are temporary, but in case of ulcerative, the loss is permanent and almost all. Okay, it is mild and it is progressive. Okay, its complication are occasional and its complication are usual, and they are also very serious. Then there is posterior blepharitis. We have discussed the anterior blepharitis. Now there is posterior blepharitis. In case of posterior blepharitis, the gland that is present near away from the anterior lid margin is affected, and that is the meibomian glands. So there is hypersecretion of these glands. Due to the hypersecretion, these signs may include like foamy secretion, secretion become white or frothy. Okay, this pouting of gland orifices, visible ducts, or extensive oil secretion occur. Duct may be obstructed due to lesion. So posterior blepharitis is simply the inflammation of meibomian glands. Okay, its sign includes frothy secretion, then the glands orifice become very pouting, or there's visible ducts opening there appear. Okay, then there's excess of oil production, or there may be the blockage of these ducts. So its treatment includes systematic antibiotics, eyelid hygiene, or topical steroids can be used. Okay, because the tears have a film of the eye which is mainly produced by the meibomian glands. In this case, the meibomian gland function is disrupted, so we have to give artificial tears because the normal tears are affected, they are not produced normally because of the dysfunction of this gland. The other topic is trichiasis. So simply these are eyelid, simple words, they move away from your eye. Okay, but if in some case they start, instead of going away, they start moving inward toward the eye, this condition is known as trichiasis. Simply the eyelashes, instead of moving away, they start moving inward. So if they start moving inward, you can feel like foreign body, there's staring, there's light sensitivity due to the lashes, so they are rubbing your cornea. Okay, and there's conjunctival redness, there may be corneal damage, ulceration may occur. Okay, so simple words, eyelashes moving inward to the eyes, so they cause foreign body sensation and all of these symptoms. It may occur due to chronic blepharitis, due to chronic conjunctivitis, autoimmune conditions, or chemical burns. So what are its treatment? So first is we mechanically remove the eyelashes. Okay, from far with forceps. So this is known as epilation. Epilation is simply the mechanical removal of eyelashes, because eyelashes have problem, instead of going away, they are going towards the eye. Second, there are other treatments in which we destroy the eyelashes. So first one is electrolysis. We use electrical current to destroy the lash follicles. The other is argon laser. We use laser to destroy. The other is cryotherapy, in which we freeze the follicle and destroy them. So these are basically the different ways to destroy the eyelashes because they are causing the problem. The other is contact lens. So because these eyelashes are moving towards our eye, so we can use contact lens in case to protect our cornea. So we can go for surgery in which there is full thickness wedge dissection of localized trichiasis. So we will dissect those part where the eyelashes are moving inward. Okay, the other topic is entropion. So now the problem is not with the eyelashes. Now the problem is with the eyelid. The whole of the eyelid is turning inwards. In the trichiasis, as we have discussed, the problem is with eyelashes. Eyelashes are moving inward. But in this case, the whole of the eyelid is moving inward. As you can see in this pic, eyelid is moving inward. Okay, it has two types. First one is congenital, the other one is acquired, which is present at the birth, and the other is required will occur later in life. Okay, so its causes. First one is senile, which occur in older people. So there is inward turn of the eyelid. Okay, as you can see. So what are the symptoms? Now the problem is the eyelashes, they also move inward. In the trichiasis, the problem was not with the eyelid. The problem was with some of the eyelashes. But now the problem is with the whole of the eyelid. The whole of the eyelid is moving inward. Okay. So the symptom will be same, like you will feel something in your eye, watery eyes, eye will be red. So this scratches on the cornea, and there is possible infection. Same as that was in the case of trichiasis. Okay. Now its treatment. treatment is artificial tears, lubricating, and the eyelid trapping. We tape the eyelid to pull it away from the eye, stopping the eyelashes from rubbing against the eyeball. Okay. Then these are spastic, congenital. In the case of whenever you can use injection, Botox injection. We can go for surgery. Okay. The other is ectropion. In ectropion, the whole of the eyelid was moving inward. In ectropion, the whole of the eyelid flipped outward. So it exposed the inner part of the eyelid, like this part, and eye become unprotected. So it also have different types, like in the case of entropion, these are the congenital, acquired, senile, which occur with age, and the other like paralytic and cicatricial. So we grade ectropion on the base of how much the eyelid is moved outward. Grade 1, only the puncture, the tear duct is opening. Grade 2, the eyelid margin is torn outward and the inner lining of palpebral conjunctiva is visible. So there are the presence of some tear ducts. So if they are only tear ducts that are visible, we called it grade 1. But if the palpebral conjunctiva is visible, we called it grade 2. Okay. Then its symptom, first one is watery eyes. Okay. The other symptom is chronic conjunctivitis may occur. It can cause exposure to the keratinitis because the cornea is irritated, so it is exposed the tear film, because in this case, as you can see, the cornea is now not protected. So in that case, keratinitis may occur. It may cause dermatitis or or corneal ulceration because the cornea is not protected. In that case, all of the complication occur because non-protection of the cornea and then the eyeball. So in this condition, we go for different treatments. The first one is senile ectropion. So in this case, we go for medial conjunctivoplasty. So in this case, the problem is with the, as we know in ectropion, the problem is with the eyelid. It has moved a little bit outward. So what we do, we remove a little bit part of the eyelid and then stitch it. So in this case, the eyelid will move a little bit inward. So we normally remove a diamond shaped piece, as you can see in this the big, okay, diamond shape. So it is further divided into two. This medial conjunctivoplasty is further divided into two. First one is horizontal. In this case, surgeon remove a pentagon shaped piece like this one, okay, with the full thickness of the eyelid and shorten it. Okay. So simply the surgeon remove pentagon shape, okay, and then fixes it, and the eyelid will move a little bit inward. The other is the modified Shemanowski procedure. For this, the surgeon remove a pentagon like this one, and surgeon also remove a triangle of the skin like from this part. So in both cases, the little bit difference is the triangle of skin. Pentagon shape piece is same, okay, and then tighten the eyelid. Okay. The other is cicatricial. So this occur, as we have discussed, due to the scarring of the eyelid. So there are two treatments mainly. First one is V and Y operation. So V shape cut is given, then a Y shape stitching occur. So this will, so in this case, this is like, this is the eyelid. Now after doing this, the eyelid will move little bit inward like this at this place, at its original place. Then the other is Z plasty. So it is for moderate case, the surgeon rearranges the scarred like Z shape pattern. So little bit different, like this was V shape and Y shape. In that case, it was like Z shape. Okay. In severe cases, skin grafting can be done also. So the other is if the ectropion occur due to facial nerve palsy, because facial nerve palsy, in this case, the facial nerve is providing or supplying the eyelid. So if the palsy of the facial nerve occur, the eyelid will move outward. So what we do in that case, we give the artificial tears, we can give the lubricating ointment, or the last The other is tarsophy, because in the case of the nerve damage, if nerve damage occur, it cannot be easily recovered. Okay, so in that case this is done. So in this case the surgeon stitches the part of eyelid together permanently to narrow the eye opening and to protect it. Okay, but case of congenital, if it occurs, then surgical repair is done. The surgeon performs the surgery to fix the eyelid and place it back to the position, because it is due to congenital cause, so we go for simply the surgical repair.